This is session 4, Overview of Prostate Cancer. In this session, we will discuss what prostate cancer is, the anatomy of the prostate, and the burden of prostate cancer. We will also discuss what the risk factors and symptoms are for prostate cancer. We will go over the types of prostate cancer screening, questions to ask the doctor, and the treatment options for prostate cancer. Cells in the prostate that are not normal and grow out of control are prostate cancer. The exact cause of prostate cancer is not known. If detected early, prostate cancer can be treated and even cured. Some prostate cancers grow quickly and can become a serious threat. Other prostate cancers grow slowly and may never be a serious health threat. The prostate is the part of the male reproductive system. It is a gland that only men have. The prostate is about the size of a walnut. The prostate is located just below the bladder and in front of the rectum. The urethra runs through the prostate. The urethra is the tube that carries urine outside of the body from the bladder. As men age, the prostate tends to increase in size. This is an image of the anatomy of the prostate. It also shows where the rectum, bladder, and urethra are located. This image shows the anatomy as well as the stages of prostate cancer. In the first image on the upper left, there is no prostate cancer present. Stage 1 cancer has a small tumor in the prostate. Stage 2A, the tumor is beginning to grow larger, and in stage 2B, the tumor has begun to spread, even more in the prostate. This image shows stages 3 and 4 of prostate cancer. In stage 3, the prostate cancer has begun to spread throughout all of the prostate. The last image on the right side is stage 4 of prostate cancer. Prostate cancer is the 4th leading cause of death in African American men over the age of 45. Prostate cancer is also the 2nd leading cause of death from cancer in all African American men. In 2013, 176,450 men in the U.S. were diagnosed with prostate cancer. In 2011, almost 4,000 men in Maryland were diagnosed with prostate cancer. In 2013, there were approximately 28,000 deaths from prostate cancer. The numbers in Maryland totaled just under 500. African American men have the highest rate of prostate cancer in the world. 1 in 5 African American men will be diagnosed with prostate cancer in their lifetime. Though the exact cause of prostate cancer is not known, doctors know that men with certain risk factors are more likely than others to develop prostate cancer. Age is one risk factor for prostate cancer. The chance of getting prostate cancer goes up as a man gets older. Race is another risk factor for prostate cancer. Prostate cancer is more common among African American men. Lastly, a man's family history is a risk factor for prostate cancer. A man with a father or brother who has prostate cancer has a higher risk of getting prostate cancer. A man can have prostate cancer and not know it. Some symptoms can include blood in the urine or semen, and needing to urinate often, especially at night. Another symptom is having trouble starting or holding back urine. Further symptoms of prostate cancer may include an interrupted or weak urine flow, or a pain or burning feeling while urinating. Having a constant pain in the lower back and/or pelvis, or having painful ejaculation are another 2 symptoms of prostate cancer. Symptoms can be caused by other problems, including an enlarged prostate or infection. Having these symptoms does not mean that you have cancer, but you need to talk to your doctor to be sure. If you are experiencing any of the symptoms listed on the previous slides, you should visit your doctor immediately. Your doctor can check for prostate cancer before you have any symptoms. During an office visit, your doctor will ask you about your personal and family medical history. You will then have a physical exam. As treatment is more likely to work well when prostate cancer is detected early, it is important that you visit your doctor to be screened. Screening means looking for signs of disease even if men have no symptoms. Screening for prostate cancer is looking for disease at an early stage when treatment is likely to work better. The recommendations to begin talking to your doctor about prostate cancer screening are different for different men. For men at average risk of prostate cancer, screening is recommended to start at age 50. For high-risk men, including African Americans, or those who have a father, brother, or son who has had prostate cancer before age 65, screening is recommended to start at age 45. For men with more than one first-degree relative who has had prostate cancer before age 65, screening is recommended to start at age 40. There are two main screening tests for prostate cancer: the digital rectal exam, or DRE, and the prostate-specific antigen test, or PSA. The tests cannot tell if you have cancer, but they will tell if you need further specific tests for prostate cancer. The digital rectal exam is a quick exam that checks the health of the prostate. The doctor inserts a gloved and lubricated finger into the rectum. The doctor is able to feel the back of the prostate for size and anything out of the ordinary. PSA is produced by cells in the prostate gland and is released into the blood. The PSA test measures the amount of PSA found in the blood. The PSA level is checked to see if it is normal. A higher PSA level means there may be a problem with the prostate. Many things can increase PSA levels. The first reason for increased PSA levels is because some prostate glands produce more PSA than others. Also, PSA levels usually increase with age. Another reason is because African American men usually have higher PSA levels than others. There are other reasons not listed here that can cause increased levels, including other prostate conditions that are not cancer. No test is always right, and this is true for both the DRE and PSA tests. The PSA test is good at telling if small cancers are present. The DRE can sometimes tell if there is cancer when the PSA levels are normal. This is why both tests are usually done. A large study found that if 100 African American men over the age of 50 took a PSA test, 87 men would have a normal PSA, but a small number of these men would have cancer that the test missed. 13 men would have a higher than normal PSA level. After more tests, 8 men will not have prostate cancer, and 5 men will have prostate cancer. This shows why it is important to have both a digital rectal exam with a PSA test. Just because you have a high PSA level, it does not necessarily mean that you have prostate cancer. If the DRE and PSA tests are positive, more testing is needed to see if cancer is present. Your doctor will likely refer you to a urologist. A urologist is a doctor that has training in prostate-related problems. The urologist may then perform a transrectal ultrasound. Though it is not the best tool by itself, a transrectal ultrasound can be useful to follow up a high PSA level or a positive DRE. If a doctor thinks cancer is present, a biopsy may be done. For a biopsy, tiny samples of the prostate are removed with a needle. The sample is examined under a microscope to look for any cancer cells. There are many reasons why men do not get screened for prostate cancer. Some of these reasons are lack of knowledge about prostate cancer, passive approach to healthcare, and denial about possible health problems. Further reasons men don't get screened include a lack of knowledge about prostate cancer screening, such as where to get screened, the cost of screening, not having health insurance, and an unawareness of what age to begin screening. Here are a few more reasons why men don't get screened. They may distrust the healthcare system or have a fear of the tests. Men may also be embarrassed or experience discomfort during these tests. Lastly, men may have a fear of being diagnosed with prostate cancer. Reasons for not getting screened can be overcome with knowledge about prostate cancer and screening options. Having support from the CHA, family, and friends is also important in helping men to get screened. Here are some examples of questions that you should ask your doctor. One example: at what age do I start getting tested? Other examples include: how often will I need to be screened? And who will do the exam? Here are more questions that you should ask your doctor about prostate cancer screening. Another example question you could ask your doctor is: how do I prepare for the screening? You should also ask your doctor if you can return to work after the exam, and if you can drive after the exam. Here's the last set of questions that you might want to consider asking your doctor about prostate cancer screening. You should ask if there are any risks associated with the exams. Another question to ask: will my insurance cover the screening? How much will my screening cost? Men with prostate cancer have many different treatment options. The treatment that is best for one man may not be best for another. We will now go over some treatment options. The first treatment option is watchful waiting. This is also known as active surveillance. It means doing the PSA test and the DRE, often to keep an eye on cancer. Another treatment for prostate cancer is internal radiation therapy. This is also known as brachytherapy. This treatment involves surgically placing small radioactive pellets inside the prostate to destroy cancer cells. Hormone therapy is another treatment option. This treatment reduces the body's ability to make certain hormones, which keeps prostate cancer cells from growing. Biological treatment and chemotherapy are also options. Biological treatment works with your body's immune system to fight cancer or control other side effects to other treatments. Chemotherapy uses special drugs that can kill or shrink cancers. Newer treatment options that are still being researched include cryotherapy, or freezing and destroying cancer cells, and high-intensity focused ultrasound. Ultrasound uses sound waves targeted at cancer cells to kill them. Prostate cancer treatments can lead to erectile dysfunction, or ED. This only happens in some men. Every man's situation is different, and the only way to know about your chances for recovery is by talking to your doctor about his or her success. What are the possible outcomes for you? Different treatment options lead to different chances of getting ED. Erectile dysfunction affects about 30 million men in the US. Erectile dysfunction is the inability to produce an erection acceptable for intercourse. It is also known as impotence. It is caused by many different things. These causes can be psychological, physical, or surgical. There are many different treatments for erectile dysfunction. Your doctor may assess your sexual health using a sexual health inventory sheet for men, or SHIM. The questions will be rated from 1 to 5 and added together to find a total to assess your level of erectile dysfunction. The SHIM sheet may be completed at home or in your doctor's office. The scale is graded from 1 to 5, with 1 representing a very poor score and 5 being very high. For this scale, very high is considered normal. There are 5 common questions that your doctor may ask you. How do you rate your confidence to get and keep an erection? How often were your erections hard enough for penetration? How often were you able to maintain your erections after penetration? The final 2 questions are, how difficult was it to maintain your erection to completion of intercourse? And, when you attempted, how satisfactory was sexual intercourse for you? Some medical experts are unsure if the benefits of screening outweigh the known side effects of treatment. They recommend that all men learn about the pros and cons of screening before making their own decision. Men should discuss the pros and the cons with their doctor before deciding if they want to be screened. A man should take into account his age, as African American men 45 and older should consider getting screened. A man should also consider his general health status and risk factors, such as family history. He should consider what he would do if he was told that he had a higher than normal PSA or a DRE that requires more tests. There are pros and cons to prostate cancer screening. Not only should you discuss prostate cancer screening with your doctor, but you should also be aware of the pros and cons to screening. Here are some of the pros to prostate cancer screening. The first pro is that PSA tests may find prostate cancer early, when it's treatable. Also, the number of prostate cancer deaths has dropped since PSA tests have been used. Getting tested may put a man's mind at ease. And lastly, PSA tests can be used to check if cancer is getting worse and if it is responding to treatment. Here are some of the cons for prostate cancer screening. Screening has the potential for unnecessary treatment. Also, treatment can cause impotence and/or incontinence, and a PSA test can result in a false positive. Again, you should be sure to discuss prostate cancer screening with your doctor and make sure he has addressed all of the concerns and questions that you might have. Now we will address some common prostate cancer myths. Many men believe that prostate cancer is an older man's disease. A question: I thought only older men can get prostate cancer. Do younger men get prostate cancer too? To answer this question, while many cases of prostate cancer are in older men, younger men can still get prostate cancer. Another myth many men believe is if you have prostate cancer, you will know because of the symptoms. However, a man can have prostate cancer and not have any symptoms. For early detection of prostate cancer, screening should happen before there are any symptoms. Many also believe that nobody dies from prostate cancer. This, however, is not true, and many men die from prostate cancer every year. Therefore, early detection of prostate cancer is best when treatment may be more effective. Another myth about prostate cancer is many men believe that surgery or radiation is always best. A question: after talking to the men in my family, they said that surgery or radiation is always the best treatment. Is that true? Answer: this is not necessarily true, because some prostate cancers grow very slowly and may never become a problem. Watchful waiting or other treatment options may be better for certain types of prostate cancer. Myths that impotence always follow treatment and vitamins or herbs can prevent or treat prostate cancer are also not true. Here are some take-home points from this session. First, prostate cancer begins when the cells in the prostate are not growing normally. Some prostate cancers grow quickly, while others grow more slowly and can be monitored over time. The cause for prostate cancer is not yet known, but there are 3 common risk factors for prostate cancer. These risk factors are age, race, and family history. It is also important to remember that early symptoms should be reported immediately to your doctor, and screening can detect cancer in its early stages. Every man should talk to his doctor about deciding to get screened. If prostate cancer is found, there are many different types of treatment available. Thank you.